Hello, my name is Robert Rhee. I am the Chief of Vascular Surgery at Maimonides Medical Center in Brooklyn, New York. The unmet needs are primarily based on the sealing zone proximally. Originally, the stent grafts were developed for relatively straight and non-angulated necks. And in fact, most of these devices were designed to seal in a 15 millimeter seal zone. So many of the patients that we've been treating up to now have been treated with devices that were really not intended for use in hostile necks, such as short necks and angulated necks. So the biggest unmet need is to have a device which is the precision and the deliverability of sealing in a zone that's less than optimal. The Excluder Conformable Stent Graft, which was the topic of my lecture, was developed in response to this unmet need. In fact, from the very beginning, it was engineered and tested to be used in hostile necks, namely highly angulated necks up to 90 degrees of angulation, as well as a short neck up to 10 millimeters of sealing zone. So the stent rose, as well as the structure of the proximal graft, was designed exactly to fit and function in this hostile neck situation. Of course, it will function in any neck, but it was specifically engineered for this. The remainder of the device, including the iliac limbs, were essentially maintained from the previous version of the excluder, or the C3 version. So this is actually the first true second generation Gore endovascular device. I was the principal, and I continue to be the principal investigator for the USA trial. And the trial was divided into two arms: the short neck subset, as well as the high angle subset. The short neck subset composed of 80 patients, and that trial was completed at the end of 2020 and was submitted for FDA approval and was FDA approved in January of 2021.